We have one proclamation for National Health Center Week, and Councilmember Zappone is going to read that, and Mike Weiser is going to accept it. Mike, you can come on up to the podium.
Whereas for over 55 years, community health centers have provided high-quality, affordable, comprehensive primary and preventative health care in underserved communities, having a significant impact on America's healthcare system. And whereas, as the country's largest primary care network, CHCs are the healthcare home for over 30 million Americans in over 14,000 communities across the nation, serving 1 in 12 people in the United States. And whereas CHCs serve as beacons of essential resources and support in testing and treatment in the face of the global coronavirus pandemic, and will continue to offer reliable, affordable, high-quality care against COVID-19 for America's most vulnerable and underserved communities. And whereas every day, CHCs develop new approaches to integrating a wide range of services beyond primary care, including oral health, vision, behavioral health, and pharmacy services to meet the needs and challenges of their communities. And whereas CHCs are governed by patient majority boards, ensuring that patients are engaged in their healthcare decisions. And whereas CHCs are locally owned and operated businesses that serve as critical economic engines, helping to power local economies by generating $63.4 billion in economic activity in some of the country's most economically deprived communities. And whereas CHCs employ more than 253,000 people nationwide, including physicians, nurse practitioners, physician assistants, and certified nurse midwives, who work as part of a multidisciplinary clinical teams designed to treat the whole patient. And whereas the CHC model continues to prove an efficient means of overcoming barriers to healthcare access, including geography, income, and insurance status, improving healthcare outcomes, and reducing healthcare system costs. And whereas CHCs are on the front lines of emerging healthcare crisis, providing access to care for our nation's veterans, addressing the opioid epidemic, and responding to public health threats in the wake of natural disasters. And whereas National Health Center Week celebrate America's CHC sites, their dedicated staff, board members, patients, and all those responsible for their continued success and growth since the first health care centers opened their doors more than 55 years ago. And whereas during the National Health Center Week, we celebrate the legacy of America's CHCs and their vital role in shaping the past, present, and future of America's healthcare system. Now, therefore, Brian Beggs, Spokane City Council President, on behalf of the citizens of Spokane, hereby proclaim August 7th through 13th, 2022, as National Health Center Week. That was a long one. Thanks.
All right, great. Mike, tell us more.
All right. Well, thank you, Council President Beggs and Council Members Zappone. We had some help with our national organization writing that. That's why it was so long, but appreciate spending the time to do that because it really reinforces the idea that healthcare access is so critical to the vitality of our whole city. I'm the Chief Strategy Officer with Chaz Health. We're one of 3 community health centers with clinics in Spokane. There's about a dozen in total, along with Native Project and Unify Health. And we wouldn't have the wide variety of access to services that we have without partnership with the city and collaboration. About a year and a half ago, we opened up a dental clinic in the East Central neighborhood with City of Spokane support. And we've collaborated on other opportunities with the city that helped with the Rogers School-Based Health Center as well. And we're seeing an increased demand for health services nowadays, and another infectious disease challenge coming to us right now. So we look forward to future collaborations to continue to meet that need for access to health care. So thanks again.
All right, thank you.